would you do if you were having symptoms throughout the day despite being on medication? This is going to be a situation where we really encourage you to talk to your medical team and really keep track of your symptoms. We're not there with you every day, kind of like walking through your life. And so we're going to want to know, what are triggers? What are things that you have tried? Have you noticed any patterns? Or is it every day that you're having pain? Or is it just certain days? Is it related to weather? Is it related to mood? Is it related to how you slept last night? So coming to your team with as much information as you possibly can about the circumstances is really important. I would say that probably what you're going to hear first is, okay, well, are you taking your medicines? You want to make sure you've kind of covered that. You can control that piece at home. And then sometimes, it's going to be a matter of adding on an adjunct medication. Maybe that means that, if you're taking a daily medication, you have to add on like a non-steroidal medication such as Motrin, ibuprofen, naproxen, something along those lines. Sometimes it means that this is not a good fit in terms of the medication. If you and your team decide that you've given it a good enough trial, then it might be a matter of switching medicine. But I also think the other recommendations that we always make are making sure that, especially with psoriatic arthritis patients, where some of the symptoms that can improve with activity, with stretching, with yoga, with heat, that you're using all of those like non-pharmacologic approaches to help with your pain. So if the pain is coming on at the end of a long workday and you've been sitting at a desk all day, you might want to think about setting a phone alarm that every hour goes off and reminds you to stretch out your back, working with a physical therapist, working with an occupational therapist, depending on where your pain is, and really having them target stretches and activities that you can do in the place where you're having pain. We always want to treat your disease appropriately so that you are in the best position to feel well. That being said, we don't want to have you on medication that you don't need to be on. And so our goal is always going to be to start with the least amount of medicine that we think is appropriate for your degree of disease. If that doesn't work, then we'll move on to the next class of medication. It's going to be a balance of working with your rheumatologist and your dermatologist if you have skin disease to find the right one for you.